Yeah, thanks, Chair. Minister, thanks for coming in this evening in relation to this issue. I know that you get this. I know that we've made representations to you and the Department previously in relation to meat factory workers and so on, and that issue was resolved. And while I don't want to liken the issue I'm raising tonight to the plight in the meat industry, it still surrounds the issue of visas and non-EU workers in particular, so I'd appreciate your feedback on it. Initially, I'd just like to flag a couple of the positive things that have been achieved by government in the last 2 years. We've gone from 19 million hours to 24 million hours in 2020, and again in 2021 funding has been provided for 24 million home care hours, which is most welcome. And I understand that there's more home help hours being delivered to more patients than ever before in the home, as it should be and as government policy requires. That said, yesterday I attended a briefing with my local HSE management, and in the 3 hours that we were there, along with my other Oireachtas colleagues, we spoke about the well-documented recruitment crisis in the HSE, and you have anywhere between 15 and 25% of vacancy rate right across the country in terms of the filling of various vacancies. So while this difficulty in recruiting employees is obvious, amongst consultants, therapists and disability services, psychologists and other professional fields, it is perhaps most acutely felt in the area of home care, I feel. And the reason I say this is those other posts I mentioned above are in short supply globally. However, the government's the state's critical list allows those posts to be filled by international candidates, including non-EU applicants. A non-EU person can also apply for a post in a nursing home care setting and as a healthcare assistant in a hospital setting. However, non-EU candidates cannot be recruited for home care supports. I believe this policy is discriminatory, and I think it flies in the face of what we as a state are trying to promote, which is to keep people at home for as long as possible and target care and support in the home as much as is practicable. I genuinely don't understand why the critical skills list isn't amended to reflect the fact that we have hundreds of thousands of hours allocated and approved in home care, but we cannot source the staff. I can list dozens of individual cases, like I'm sure most deputies in here can, about the much needed hours allocated to various people, but for one reason or another the HSE is failing to allocate a carer to them or a service provider to be contracted to do the same. I think of one lady in particular, 92 years of age, a dementia sufferer, waiting over 12 months for a carer, and after many representations and waiting that length of time, she eventually did get half of her entitlement, but is still waiting for her full allocation. And this is being felt right across the country, right across the board. And I understand, Minister, the reluctance up to now may have been in relation to the fact that certain providers don't meet the same pay and condition standards as set by the HSE itself. But these contracts and working visas require a minimum salary of €27,000 in other circumstances. And this approximate salary isn't as high as the HSE's hourly rate of €16.50, as I said, but nonetheless is a reasonable starting salary for many of these workers. I urge the Minister and the Department to revise the criteria for the critical skills occupation list, and let's deliver the whole allocation of hours and get the urgent care that these elderly and vulnerable people need.
Thank you, Deputy. Pádraig.
Thanks, Chair, and I want to thank Deputy Pádraig O'Sullivan for raising this very important issue here tonight. And you're right, it is one that we are aware of as a department, and certainly as a government, it's been brought to attention quite a lot, even through questions here. But with the Taoiseach, Micheál Martin as well, also saying that this is something that he felt might be addressed and looked at through the PARMA process this year as well. As you know, our colleague Minister Mary Butler has also working very clearly in this area and has put together the working group, the strategic workforce working group to look at this. It's due to report back in September. I have a full topic on that later on, so I won't give the full answer on that, but it is an issue that she's trying to address, and I have engaged with her around this as well to see, even before September, if there's ways we can bring forward solutions under the category that you've mentioned in relation to the permits as well. So it is something we're aware of and something we're looking at, and you're right, there's quite a lot of families out there waiting for support, and we're trying to do, the funding is approved through the government various departments, but it's the personnel to implement that we need to try to address, and I think we need to look at it as a combination of solutions. Minister Butler is taking the long-term view on this, how to address this permanently, with a workforce planning situation as well, and hopefully her report will give us something to work on come the autumn as well. In relation to the issue you're asking specifically around the upcoming review of the permit situation, how can it be addressed on that? I just want to probably explain a bit behind that permit scheme what it's about. So Ireland's employment permit system is designed to accommodate the arrival of non-EAA nationals to fill skills and labour gaps for the benefit of our economy in the short to medium term, but this objective must be balanced with the need to ensure that there are no suitably qualified Irish EAA nationals available to undertake the work, and the shortage is a genuine one. Deputy Pádraig O'Sullivan knows this because you've been engaged in the system quite a lot and quite successfully as well. The system is managed through the operation of the critical skills in an eligible occupations list, which determine employments that are either in high demand or are ineligible for an employment permit, where it is evidence that there should be sufficient availability of those skills in the domestic and EAA labour market. In order to ensure that the employment permit system is aligned with current labour market intelligence, these lists undergo regular evidence-based review guided by relevant research, public stakeholder consultation, and incorporate the views of the Economic Migration Interdepartmental Group, which includes representatives from the Department of Health. Account is also taken of upskilling and training initiatives and other known contextual factors such as the ending of the pandemic unemployment payment schemes and the Ukrainian humanitarian crisis and their impact on the labour market. Currently, home care workers are not eligible for an employment permit, as you've correctly flagged here tonight. While submissions from the home care sector were considered at the most recently concluded review announced towards the end of last year in October did not recommend removal of the occupation of care workers home cares from the ineligible occupations list, as the evidence suggested that the contracts of employment on offer and employment in terms of conditions being offered are factors in the recruitment challenges faced by the sector rather than the demonstrable labour market shortage. Since that, I have engaged with some of the providers in some of the sectors to try to analyse this data with them and to highlight that it is a concern for us that a high percentage of the workers in that sector were part-time, which would point to the option that maybe there was an option to have long-term contracts or full-hour contracts as well. So they understand our concerns and they are now, I understand, preparing a submission for the next review, which would come up quite soon. In order to add or remove an occupation from the list, evidence is sought demonstrating that recruitment difficulties are solely due to genuine shortages across the EAA and not to other factors such as salary or employment conditions. And this is what I would have outlined in my meetings with them and also in conversation with Minister Butler as well. Sectors in general are also required to engage structurally with the Public Employment Service of the Department of Social Protection. The review process invites stakeholders through the public consultation to provide data to substantiate claims of lack of skills or labour available in a detailed evidence-based business case. So while you correctly highlight the need from the client point of view and from patients who need help and home care, we also expect the providers to show that they've gone to every effort to source staff and pay good terms and conditions within Ireland and within the EAA as well, and to engage with the Department of Social Protection. The longer term approach is required, which I touched on at the start by Minister Butler, but in the short term there will be an opportunity as when we open the system again for review of the employment permits to make those submissions and have that evidence judged. I hope to have that date or that review opened in the next couple of weeks, and then we'll be able to judge that over the summer as well and make a decision, hopefully timely. But in doing that, I will consult directly with the Department of Health and Minister Butler as well to see can we find a solution here.
Thank you, Minister. Yeah,
thanks, Minister. Look, I think Deputy McSharry is the topical that you're referring to later. I think he's a topical amongst the similar lines. So look, I'd welcome the fact that the review is again coming up in the next couple of months, and I'm just hoping and praying that this will be taken into consideration, this suggestion. And it's been made by a number of deputies over the last few months. If there was ever a no-brainer, and I don't like to use that kind of language, but this is a no-brainer. And you did say that the sector must demonstrate that the requirement is there for the additional intake of employees from non-EU countries. I think the most demonstrable fact of that is the fact that there's hundreds of thousands of hours that are not being utilised. If there was ever a business case that needs to be made, surely that is it, and I hope the department takes that into consideration. I have to agree with you on the role of Minister Butler here. She has done a good job since she assumed office, and she has increased the budget considerably since she took over, and the amount of hours, as I referenced in my opening, she has accumulated, I think, an additional 5 million hours per annum, which is much needed. But again, those hours are useless unless people can avail of them, and I genuinely, as I said, hope that this can be looked at. I'm aware of the advisory group deliberating in the next couple of months, and as I said, I feel that now it's very important that we get people the care that they need. As I said earlier, national policy is to keep people at home as comfortable as possible, giving them the care needs that they can have in their own house as best as possible. And I think that this kind of move would provide for that. And as I said earlier, I understand that the visa requirement is that these employees would earn €27,000 minimum. But that's something that the sector itself needs to work at. Given that you said, a lot of their staff would be part-time, this might, they might be able to expand the workforce there, improve pay and conditions by doing that. But even a rudimentary sum done on €27,000 a year at 39 hours a week would be equivalent to about €13.50, €14 an hour, which, okay, it's above the average industrial wage. It's above the minimum wage. But it's below the HSE wage, that's true. But it's, as I said, €27,000 isn't a wage to be sniffed at. Margaret.
O'Sullivan for raising this and raising the scenario out there, because we know there's many people out there who have approved hours and need help, and it is government policy to try and keep people at home as long as they possibly can, and give them the care and support they need to be able to achieve that. So that's something that we are very much focused on, and again we will work with all officials, all departments to try and make it happen. Currently department officials are actively engaged with the Department of Health in relation to the recruitment challenges that you've outlined, and my department is a member of the Cross-Departmental Strategic Workforce Advisory Group chaired by the Department of Health. The areas being considered by that group include recruitment, retention, training, paying conditions, and the career development of frontline carers and home support and nursing homes into the future. Because in some areas, when we do sanction the use of a permit, it does involve training as well. And you mentioned the rate of $27,500, which was set for the healthcare assistant last April, over a year ago. That doesn't have to be the exact same amount of money. It can vary for the different sectors and for the different areas, but we do try to, be at the high end. We don't want to try to undercut the market by bringing in talent from abroad as well. But a figure around that probably sounds like about appropriate as well. So the group that Mary Butler chairs provides a forum for agreement on strategic approaches to address these workforce challenges in the sector, and will develop a set of recommendations for the Minister of Health's consideration, outlining the group's key findings and a proposed action plan to support implementation of these recommendations by September 2022. Naturally, we would have hoped that report would have been finished in time to feed into our review of the permits, but it doesn't look like that it will be. The timing of our next review of the occupational list will be kept, and in relation to the permits, will be kept under consideration by my department in the context of clearing the current employment permits backlog, but it is intention to have it open if we can in the next few weeks. We usually have it open around June or July most years, and again in the autumn. When open, submissions will be invited from sector representative bodies and interested parties via the public consultation forum accessible on my department's website throughout the consultation period, and I happily will engage with the various sectors as well, which make a very strong case. But it would be important that we do capture the evidence that shows that every effort is made to try to recruit people on decent contracts with decent pay locally and within Europe as well. And it's important that they would engage with social protection and the Jury's advertising portal when they're doing that as well. Thanks, Chair.